The Brotherhood of Blessed Gérard is the relief organization of the Order of Malta in South Africa. It was founded on the 28th of October 1992 with the aim to organize the charitable work of the Catholic Church in the Greater Mandini area properly. We are a South African public benefit organization operated not for profit. And we serve the needy irrespective of their creed, color of skin, sexual orientation, and political affiliation. We serve an impoverished community. Therefore, we render all our services free of charge and have to rely solely on donations and grants to finance our work. We are named after Blessed Gérard, the founder of the Order of Malta. Now let me tell you about our AIDS treatment program, our HEART program. On the 23rd of May 1994, we launched our HIV/AIDS education program. We went to factories, to schools, and to churches to tell people about HIV and AIDS and how to prevent getting infected and what to do when you are infected. This marked the beginning of the formal HIV/AIDS awareness and prevention activities of our organization. The creation of the hospice infrastructure started on the 5th of August 1995 with a groundbreaking ceremony for Blessed Gérard's Care Center in Mandini. This project was designed as a hospice and care center in an area severely affected by HIV and AIDS. The South African Drum magazine described Sundumbili, the main township of Mandini, in 1997 as the death city, the AIDS capital of KwaZulu-Natal. In January 2004, 76% of the HIV tests in the Sundumbili clinic were HIV positive. It was on the 3rd of September 1996 that Blessed Gérard's Care Center was officially inaugurated. The opening marks the beginning of hospice work and long-term care for terminally ill AIDS patients. In 1997 to 2002, we expanded our hospice services, our home nursing, our social support, our care for poor and chronically ill patients, and our children's services. These developments later became the basis for antiretroviral treatment support systems. The beginning of the great impact on the AIDS treatment in our country was on the 3rd to the 6th of August 2003, the first South African AIDS conference in Durban. BBC came and interviewed us on the 5th of August 2003, but not only us, but also the Director General of Health, Dr. Eyandan Saluba.
There's a gap between what the hospitals sometimes think they can do and what in reality happens. Because if you went to the same Mandini, to the same hospital, it's a different thing between doctors, whether they've got the capacity to administer drugs to patients. It's another thing whether those patients have got the support mechanisms to make sure that they take those drugs regularly, they are able to be monitored properly, and we've got the outreach programs.
We accepted the challenge and within 9 months had developed and launched a treatment program that combined drug administration, patient support, and treatment monitoring through our outreach services. It was on the 8th of August 2003 that the South African Cabinet instructed the Department of Health to develop a national ARV rollout plan. In September 2003, Blessed Gérard's Hospice was invited by the AIDS desk of the Southern African Catholic Bishops' Conference to participate as a pilot site in the planned Catholic antiretroviral treatment program. So we became a pilot site in this program of the Catholic Church. It was on the 19th of November 2003 that the South African Cabinet approved the operational plan for comprehensive HIV and AIDS care, management and treatment, and therefore officially committed the government to provide ARVs to the public sector. It was on the 10th of December 2003 that the KwaZulu-Natal Premier, Lionel Mtshali, visited Blessed Gérard's Care Centre, highlighting the increasing public recognition of our AIDS treatment program. Our professional training started for management, our doctors and our nurses, with a basic training in HIV/AIDS management through the Foundation for Professional Development of the South African Medical Association, and the advanced training in antiretroviral treatment through the HIV/AIDS Clinicians Society of Southern Africa. Our program was officially launched on the 1st of April 2004. The program includes counseling, HIV testing, treatment readiness training, treatment for opportunistic infections, antiretroviral treatment, blood monitoring, adherence support, and home care. Blessed Gérard's Hospice Heart Program became the third Catholic heart program in South Africa. It is one of the flagship SACBC AIDS relief treatment centers, and it became a model site for community-based HIV care, adherence support, and antiretroviral treatment delivery. Blessed Gérard's Care Center belongs to the very first wave of HIV/AIDS treatment providers in South Africa. ITV interviewed President Thabo Mbeki on the 30th of April 2004, and they said,
South Africa's President Thabo Mbeki told me the government is getting to grips with the problem.
We are dealing with poor people who are underfed, suffer from malnutrition and so on. And so long as you don't address these problems, interventions with drugs on their own are not going to help.
We accepted the challenge, became an active partner in the Provincial AIDS Initiative, and contributed our expertise and training programs to support the implementation of their AIDS treatment program. We are very proud that in June 2004, we held the first preparatory course for clinical personnel and AIDS patients about highly active antiretroviral therapy for the provincial hospital in Stenga KwaDuguza, which means that we helped the government to get their AIDS treatment program organized. Our own first heart readiness course for AIDS patients in Blessed Gérard's Hospice took place in July 2004. Our heart readiness course is a 4-week course, where 4 weeks before treatment we taught the patients about stigma, disclosure, and positive living. 3 weeks before about the basics of HIV and AIDS, opportunistic infections and cancers, and the prophylaxis of opportunistic infections. 2 weeks before about HIV and AIDS treatment, adherence, side effects, resistance, and monitoring. And the week before treatment about the operation of the heart program, and we allowed the patient to make their own ARV treatment plan together with our doctor. Of course, we had to train treatment counselors to help the patients to adhere to their medication. So we had our first formal heart treatment counselors training in July 2004. It was a week of intensive learning and practical skills building to prepare counselors to support patients on their journey to better health. You see in the green fields that we gave them the same heart readiness course as the patients got, but then additionally we taught them counseling skills, teaching skills, advanced HIV/AIDS information, and HIV/AIDS pre- and post-test counseling skills, and family counseling skills. On the 25th of August 2004, Blessed Gérard's Care Center was accredited by the KwaZulu-Natal Department of Health as an antiretroviral therapy center. On the 7th of September 2004, the great day had arrived that the first AIDS patient started antiretroviral treatment through Blessed Gérard's Hospice Heart Program. A milestone in hope, care, and new beginnings. She was patient number 1, and by the end of the year, we had 35 patients in lifelong treatment for HIV. And here you see a graph about our patient numbers over 22 years, starting with 35 patients. In 2014, we reached our peak with 736, and currently we have 544 patients in lifelong treatment. In 2005, we expanded our program rapidly. The program expanded through community adherence counseling, home visits, and increasing treatment enrollment. And by the end of 2005, we had 70 patients on lifelong AIDS treatment. On the 17th of March 2006, Blessed Gérard's Hospice became a member of the Hospice Palliative Care Association of South Africa to network with a professional body for hospices. And by the end of the year, we had 105 AIDS patients on lifelong treatment. The year after, 2007, we reached 140 patients on heart. Reports mention strong adherence monitoring systems, increasing outpatient treatment, and extensive counselor involvement. Our building became too small for our operations, so from July 2007 to June 2008, we built major extensions to our care center, including expanded treatment facilities for our AIDS patients. The expanded Blessed Gérard's Care Center facilities, including our new AIDS treatment clinic, was officially opened and blessed by Bishop Molelo Khumalo on the 22nd of June 2008. And by the end of the year 2008, we had 159 patients on lifelong AIDS treatment. On the 2nd of April 2009, we integrated multiple charitable projects into Blessed Gérard's Care Center and created a fully integrated health and social care structure. Ever since, we have the following projects running in our care center: health and care projects, AIDS treatment, palliative care center, and a poor sick fund. Childcare projects, an early childhood development center, child and youth care center, malnutrition clinic, and a bursary fund. And an emergency relief and social project, which is our emergency relief fund. By the end of 2009, we had 2,025 patients on lifelong AIDS treatment. It was on the 1st of July 2010 that Blessed Gérard's Care Center was officially registered as a not-for-profit organization, which means that we, from that point onwards, we could issue tax certificates to our South African donors as well. 319 patients were by the end of 2010 on our roll for lifelong AIDS treatment. Between 2011 and 2014, we rapidly expanded our chronic HIV care. from 440 patients in 2011 to 569 in 2012, to 698 in 2013, and to 736 in 2014, which was our historic peak. The program evolves into a large chronic care ART system, a community adherence network, and a comprehensive HIV outpatient program. Between 2015 and 2020, our program stabilized at roughly 700 long-term AIDS patients annually. From 729 in 2015 to 720 in 2016, to 712 in 2017, 703 in 2018, 697 in 2019, and 691 in 2020. The program is our largest service. We had big problems, of course, like everybody had during the COVID-19 period, 2020 and to 2021. That disrupted our home visits, our counseling, our patient monitoring, and our transport system. But in spite of that, lifelong treatment continued uninterrupted, that we even brought medication to our patients to their homes so that they did not have to default on their treatment. By the end of 2021, we had 625 lifelong heart patients on our treatment. During the COVID pandemic, we had to look after our patients who had no income anymore and had nothing to eat. So we distributed 2,180 food packages. One of those packets fed 4 people for 30 days with 3 meals a day. And that means in total 784,800 food portions, which we had given to our AIDS patients and to our home care patients, that they did not have to die from hunger. Our program transitioned increasingly into a long-term chronic HIV management program between 2022 and 2024. From 615 AIDS patients in 2022 to 606 in 23 and 584 in 24. In 23, we reported 3,978 outpatient consultations, 2,155 adherence home visits, and in 24, 3,905 outpatient consultations and 2,213 adherence home visits. The program remains heavily community-based and adherence-focused. The recent development in the last year, 2025, our patient number reported as 547 patients on lifelong heart. The program continues as an HIV chronic care system, a hospice and palliative care service, and a community health program. And this year, 2026, our current patient number is 544 heart patients on lifelong AIDS treatment. Our mission continues as lifelong treatment with dignity, compassionate care for every patient, and hope, support, and healing every step of the way. Originally, we were funded by CodeAid, then PEPFAR took over via the Catholic Bishops' Conference of Southern Africa. And today the program continues as community-based, adherence-focused HIV care service. Once again, in February to August 2004, CodeAid funded our program. In 2004, PEPFAR support begins through the AIDS Relief Consortium. In May 2011, we got the news that within a few months, the PEPFAR would not fund the Bishops' Conference anymore, but deflect their monies to the South African Department of Health. So we were very happy that as a result of those negotiations, the KwaZulu-Natal Department of Health began supplying us with the ARV medication, laboratory service, and treatment for opportunistic infections, and that support continues to the present day. Even after the official PEPFAR grant cycle to the Bishops' Conference ended in 2013, we were already sorted out through our Memorandum of Understanding with the KwaZulu-Natal Department of Health. And when in May 2014, the PEPFAR no-cost extension to the Bishops' Conference ended, we were sorted out because the care center continued the program through a partnership with the KZN Department of Health and other donors. HIV medication and laboratory service will continue to be provided by the Department of Health. We moved away from emergency relief to public health integration. We transitioned our funding from an international emergency funding to a mature long-term partnership with the KwaZulu-Natal Department of Health. We de-siloed our HIV care, which means evolution of HIV management from a standalone vertical crisis program into a normalized component of an integrated chronic care system. And we deliver holistic health care, managing HIV as one of many manageable chronic conditions, treating the whole patient rather than just the disease. But we adapt also to the next horizon. The public health system is shifting. There is a big biomedical innovation. We monitor the South African public sector rollout of long-acting twice-yearly injections like lenacapavir, and just recently it has been delivered into our government system and will be given to the people. The impact on prevention, we understand how advanced long-acting pre-exposure prophylaxis stems the tide of new infections upstream before patients ever need an antiretroviral treatment clinic. And we are, of course, flexible in our systems. While medical technologies and national guidelines change, the need for an agile, local last-mile care center remains absolute. We innovate for the future. We are rooted in the community. We are committed to dignity. We are building the next horizon of care.
Most of our patients are unemployed. We don't charge them anything for being here. We are dealing mainly with cancer patients and HIV or AIDS patients that are towards the end of their life. We can accommodate up to 40 patients, and once we have done a proper assessment and we issue medication, and we do follow-ups on a monthly basis. Each team has got one professional nurse and 2 caregivers.
After accepting the status, starts the treatment, and you go the journey with that person. When they do the vital signs and screening, then they will complain of any problem, then they will come this side to see me. By the time she's due for blood, you take the specimen bloods, you see the improvement. In fact, you develop a relationship with them.
I started here as a volunteer in 1996. This place was new by the time. People, they were dying like flies. I remember another year, I was working night shift. 5 patients died in my hand, died. Unfortunately, people here in Mandeni, they are suffering of AIDS, TB, and they live under poverty. Even school children, you can see they are suffering. They also get sick, get AIDS. The rate of AIDS is too high here in Mandeni.
To help a person who's sick, it's very, very nice. It is where you show and give a trust that they can do more even though they have AIDS. So life goes on. I keep motivate them that no, you can wake up and try to do something.
That brotherhood is togetherness. And I'll be happy to die helping so we can do something.
Over the last 22 years, we have helped nearly 2,000 patients to save their lives, to give them hope, to give them a future. Not only our patients, but their families and their children. We thank all people who have helped us to do what we have done, and we ask everybody to keep us in their mind and to remember us and to help us furthermore. You can download this presentation with this QR code.
Sisigele